Bismillahirrahmanirrahim. Hello everybody. So a 39-year-old woman gravida 1 para 0 at 38 week of gestation come to the hospital for induction of labor. The patient has a history of hypertension for which she take nifedipine. The patient also has a history of asthma for which she take albuterol as needed. But she has had no recent exacerbation. On admission, her blood pressure is 140 by 80 mm of Hg and pulse is 94 per minute. After a prolonged labor, she delivered a 4.1 kg healthy boy via forceps assisted vaginal delivery or a midline episiotomy. During delivery of the placenta, excessive traction is placed on the cord causing it to avulse, and the placenta is manually extracted in pieces. An ultrasound after the extraction show a thin endometrial stripe. The episiotomy is repaired in layers. 60 minutes after delivery, the patient soaks her perineal pad. During bimanual uterine examination, 300 milliliter of clotted blood is expressed from the lower uterine segment. The uterus is soft and 4 centimeters above from the umbilicus after expression of the clot. Which of the following is the most likely cause of this patient bleeding? Coagulopathy, retained placenta, uterine atony, uterine inversion, uterine rupture. So first of all, this patient has risk factor. This patient has hypertension. Second, she delivered overweight baby. She delivered a heavy baby which was 4.1 kg baby. The third one is she having a forceps assisted vaginal delivery. Forceps assisted vaginal delivery. The fourth step on ultrasound, she having a thin endometrial strip. Fifth hint, that there is heavy blood which soaks her perineal pad, so having vaginal bleeding. After the delivery, after 60 minutes after the delivery, she having the vaginal bleeding. On the sixth hand, she having the uterus. On a physical examination, the uterus is 4 centimeters above from the umbilicus. 4 centimeters above from umbilicus. So based on these symptoms, what is the diagnosis of this patient? The diagnosis of this patient is, first, she having hypertension. Second, she deliver a overweight baby of 4.1 kg, and she having a forceps assisted vaginal delivery. On ultrasound, the endometrial is a thin endometrial stripe, and she having a heavy vaginal delivery. 60 minutes of vaginal bleeding 60 minutes after the delivery. On physical examination, the uterus is soft and 4 centimeters above from the umbilicus. So the diagnosis of this question is postpartum hemorrhage. Postpartum hemorrhage. I will explain to you that what is postpartum hemorrhage. So the diagnosis of this question is postpartum hemorrhage, and the most common cause of postpartum hemorrhage is uterine atony. So here the correct option is choice C, uterine atony. Why uterine atony? Because postpartum hemorrhage is an obstetrical emergency and a major cause of maternal mortality. Homeostasis after placental delivery is achieved by clotting and the compression of the placental side blood vessel by myometrial contraction. Disruption of either of these processes can lead to postpartum hemorrhage. Primary postpartum hemorrhage occurs less than 24 hours after delivery and is most commonly caused by uterine atony. Atony occurs when the uterus becomes fatigued, for example, from prolonged labor, or distended, fetal weight more than 400 grams. As we can see here that this patient fetal weight is 4.1 kg. Other risk factors for atony include forceps assisted. She also having the forceps assisted vaginal delivery, and hypertensive disorder. She also having the hypertension. The uterus failed to contract and is soft, boggy, and enlarged above the umbilicus on physical examination. She also having the uterus which is soft, boggy, and above the umbilicus. Now come to the incorrect one, coagulopathy A. So although postpartum hemorrhage can cause delusional coagulopathy, this patient's blood was clotting, making coagulopathy unlikely. B. Retained placenta. A retained placenta prevents the uterus from contracting effectively and can lead to postpartum hemorrhage because ultrasound show a thin endometrial stripe suggesting an empty and normal uterine cavity. Choice D. Uterine inversion. So uterine inversion occur when the uterine fundus invert and prolapses. At present with severe abdominal pain, postpartum hemorrhage, and a smooth mass protruding from the cervix or vagina. This patient normal ultrasound after delivery make inversion unlikely. Choice E. Uterine rupture. So uterine rupture is a disruption of the wall of the uterus that present with pain and bleeding. Uterine rupture rarely cause in patients who have not had any previous uterine surgery. Come again to uterine atony. Why the choice C is the correct one? Because this patient having all the sign and symptom, all the risk factor for postpartum hemorrhage. She having hypertension. She deliver overweight baby. And she having a forceps assisted vaginal delivery. On ultrasound she having a thin endometrial stripe, which means that the uterus is empty. On physical examination, the uterus is above the 4 centimeter from the umbilicus, and she having a heavy vaginal bleeding 60 minutes after delivery. So these all point goes toward the diagnosis of the postpartum hemorrhage. And